The Orthopedic Trauma and Fracture Service treats a number of conditions. Of course, we take care of the high energy, multiply fractured patients that come in after bad falls or car crashes or things like that. But we also take care of the weekend warriors and those patients who have ankle fractures or wrist fractures or pelvic fractures or femur fractures. Basically anything that's broken, we'll fix it. Some patients are brought to us by the emergency medical services or the first responders in the city or in the area, and they'll come right to the emergency room or the trauma bay, and that's when we'll first meet them. And usually they'll meet our resident staff and meet the physicians, sometimes for the first time in the operating room, because that's how serious the conditions are. Other times, when you have what we call more elective trauma, things like a broken ankle over the weekend, you'll meet me in the office, we'll go over your x-rays, and then we'll talk about whether you need surgery or not. If it's broken, usually it needs to be fixed. The Penn Orthopaedic Trauma and Fracture Service at Penn Medicine is truly unique. It's different than any program locally and many nationally. We have fellowship-trained traumatologists who work 24 hours a day, 7 days a week, 365 days a year, helping take care of those who are injured. We have groundbreaking research that's happening on a daily basis, and we have education like no other in the city of Philadelphia. Orthopedic trauma and fracture care is an evolving specialty. Years ago, everybody took care of broken bones, but the science of fixing broken bones has gotten a lot better. And so now there are people who are fellowship trained who all they do all day long is fix fractures. Our understanding of fracture surgery, the conditions that come from it, the complications that arise from it, are going to only evolve over the next 5 years as we start to better understand how to put people back together again. There is nothing that Penn-Orthopaedics and the Penn Orthopaedic Trauma and Fracture Service cannot treat. We can do it all. And part of the reason we can do it all is because of the multidisciplinary, collaborative efforts that we have within Penn Medicine.